In this video, we're going to review the medical, pharmacy, vision, dental, and wellness benefits available to Mohawk Valley Health System employees who are members of the St. Elizabeth's Medical Center unions for 2016. Let's start with the medical. For 2016, you have two medical plan options, the Blue Point 3 and an exclusive provider organization plan. First, let's take a look at the Blue Point 3 plan. Here's an overview of some of the most common medical expenses. Keep in mind, though, that this is not a complete list of all the covered medical expenses under this plan, so be sure to check out your plan documents for full details. As you can see here, there is both in and out-of-network coverage, but the costs do differ. You can also see that while many out-of-network services are subject to the deductible, there is no deductible for in-network services. The deductible is the amount that you owe for healthcare services that your health plan covers before your health plan begins to pay. So, you pay 100% of the cost of these covered medical expenses until the deductible is met. Then, coinsurance kicks in for these services. For this plan, there is a $500 out-of-network deductible for individuals. That means that you are responsible for 100% of the cost of any medical expenses that are subject to the deductible until you've reached $500. Then, your plan kicks in and you drop down to 25% coinsurance. Coinsurance is your share of the cost of a covered service, and it's calculated as a percent of the allowed amount for the service. For example, if the plan's allowed amount for an overnight hospital stay is $1,000 and you are responsible for 25% coinsurance, then your coinsurance payment would be $250. For families, there is a $750 deductible followed by 25% coinsurance, but each member within the family has their own individual $500 deductible. So, for families, there is a $750 out-of-network deductible, but there is a $500 deductible per individual. You can think of it like an individual cap. Each person pays toward the deductible, and once any one individual reaches $500, like Tom has here, coinsurance kicks in for that individual, regardless of whether or not the family as a whole has reached the $750 family deductible. The rest of the family will continue to pay toward the deductible. Again, once this deductible is met, you drop down to 25% coinsurance for all of your out-of-network covered medical expenses that are subject to the deductible. For in-network services, though, there is no deductible, so you'll pay copays from day one. A copayment is a fixed dollar amount that you pay for covered health care, and it's usually paid at the time of the service. For a primary care physician office visit, you'd pay a $25 copay. For a specialist office visit, you'd pay a $40 copay, and a $25 copay for an urgent care visit. For outpatient surgery, you'd have a $150 copay. Diagnostic laboratory and pathology, as well as preventative care, is covered in full. There is never a deductible for emergency services, so for an emergency room visit, there is a $150 copay both in and out of network. There is also what is called an out-of-pocket maximum. The out-of-pocket maximum is the most that you pay out of pocket on expenses like your deductible and any copayments or coinsurance during a policy period. Once the out-of-pocket maximum is met, your health plan begins to pay 100% of the allowed amount. So, you will never pay more than this out-of-pocket maximum in any single plan year. This ensures that health plans pay for significant health expenses, and it limits the risk of medical debt or bankruptcy for insured individuals. Note that this limit includes your deductible as well as any copayments or coinsurance, but does not include your premium or any expenses that are not covered by your health plan. This plan has a medical out-of-pocket maximum of $5,000 per individual. For families, the out-of-pocket maximum functions similar to the family deductibles. There is a $7,500 total family out-of-pocket maximum, with a $5,000 out-of-pocket maximum for each individual within the family. And note that this out-of-pocket maximum is combined for both in and out-of-network services. Now let's take a look at option 2, the Exclusive Provider Organization, or EPO plan. First, note that because this is an Exclusive Provider Organization plan, there is no out-of-network coverage. As you can see here, some medical services are subject to the deductible, while others are not. Again, the deductible is the amount that you owe for healthcare services that your health plan covers before your health plan will begin to pay. For this plan, there is a $1,000 deductible for individuals. That means that you are responsible for 100% of the cost of any medical services that are subject to the deductible, such as inpatient hospital stay or outpatient surgery, until you've reached $1,000. For families, there is a $3,000 deductible, but each member within that family is subject to their own individual deductible of $1,000. So, for families, there is a $3,000 in-network deductible, but there is a $1,000 deductible per individual. You can think of it like an individual cap. Each person pays toward the deductible, and once any one individual reaches $1,000, like Tom has here, coinsurance kicks in for that individual, regardless of whether or not the family as a whole has reached the $3,000 family deductible. The rest of the family will continue to pay toward the deductible. What that means is that if one person is using the plan more than everyone else, they don't have to wait until the family reaches that $3,000 family deductible before coinsurance kicks in for them. Once this deductible is met, you drop down to 20% coinsurance for all covered medical expenses that are subject to the deductible. For covered services that are not subject to the deductible, you'll pay copays from day one. Again, a copayment is a fixed dollar amount that you pay for covered healthcare, and it's usually paid right at the time of the service. And coinsurance is your share of the cost of a covered service, calculated as a percent of the allowed amount for the service. Primary care physician office visit, for example, is not subject to the deductible, so you'd pay a $25 copay from day one, regardless of whether or not the deductible has been met. Specialist office visits and urgent care visits are not subject to the deductible either. You'd pay a $40 copay from day one. There is a $150 copay for emergency room visits. Emergency services are never subject to the deductible. This plan has a $4,200 individual out-of-pocket maximum. Again, the out-of-pocket maximum is the most that you pay out-of-pocket on expenses, not including premium, during a policy period. Once the out-of-pocket maximum is met, your health plan begins to pay 100% of the allowed amount. So, you will never pay more than this out-of-pocket maximum in any single plan year. For families, there is a $9,200 total family out-of-pocket maximum, with a $4,200 out-of-pocket maximum for each individual within that family. Pharmacy benefits will continue to be managed by Broadreach Medical Resources, or BMR. For prescription drugs, there are 4 tiers: Tier 1 generic drugs, Tier 2 and 3 brand name drugs, and Tier 4 specialty. There's a $10 copay for Tier 1, $40 copay for Tier 2, $65 copay for Tier 3, and 5% coinsurance for Tier 4 specialty. Just like the medical, there is an out-of-pocket maximum for your pharmacy costs. This is separate from your medical out-of-pocket maximum. However, this out-of-pocket maximum will depend on which health plan you select. If you select the Bluepoint 3 Health Plan, there is a $1,600 per person out-of-pocket maximum for your pharmacy costs, with a $4,800 per family out-of-pocket maximum. If you select the EPO Health Plan, there is a $2,000 per person pharmacy out-of-pocket maximum, with a $4,000 per family out-of-pocket maximum. Again, note that this is separate from your medical out-of-pocket maximum. If you and your family choose to use the MyRx pharmacy located at St. Luke's to fill your prescriptions, you can save some money. MyRx is a pharmacy located at the St. Luke's campus dedicated to filling the prescriptions of employees of MVHS. Through MyRx, select generic drugs will be only $3, or the cost of the drug if it's lower than that. And you can get a 3-month supply of your maintenance drugs for only 2 copays instead of 3. You can even get some very inexpensive over-the-counter medications. And to make it as easy as possible, there's a designated parking spot for quick MyRx pickups. And MyRx will even ship prescriptions through the mail for employees who want to take advantage of the savings but are unable to get to the St. Luke's campus. You can contact the MyRx pharmacy at the phone number listed here. Vision benefits are provided by Davis Vision. This benefit is bundled with the medical plan, so if you obtain either of the 2 health plan options, you will automatically be enrolled into the Davis Vision plan. Note that you are not able to purchase vision as a separate benefit. Dental benefits are provided by Lifetime Benefit Solutions. There is no deductible for this dental plan. Basic services are covered at 100% of the allowed amount. Major and orthodontia services are covered at 80%. There is an annual dental maximum of $1,500 per person. And for orthodontia services, there is a $2,000 lifetime maximum. MVHS is proud of our wellness program, Better Health, Better You. All full-time employees can participate in the voluntary and confidential wellness screenings. The confidential screenings will provide you with a full panel of biometric data and will help you to identify any areas of concern. It's as simple as that. The wellness screenings are conducted by Interactive Health. If you'd like to learn more or have questions about how to participate, you can contact Interactive Health at the number listed here. So what's next? Open enrollment for 2016 benefits will take place from November 6th through December 4th. Whether you are opting in or out of benefits for 2016, you must complete and submit your option form no later than December 4th. If you're currently enrolled and would like to make changes for 2016, you'll need to complete some additional paperwork. So contact Human Resources to obtain this additional paperwork. If you choose to waive health insurance for 2016, you must provide proof of other coverage to Human Resources in order to receive the health insurance waiver stipend. We will be holding 4 benefits fairs in November. Here are the dates and locations. If you have any questions, do not hesitate to contact Human Resources.